But can the minister say whether the government intends to investigate if there are any health risks outside of the international norms to the citizens and the residents of the Cayman Islands before permission is granted for installation? Just to clarify my intent here, Madam Speaker, I think that the magnitude of the concern across the world justifies more than just the normal processes of listening to international specialists. By all means, they are the experts involved in this and will give us the direction normally. But we've even seen qualified specialists across the world have their concerns. And radiation is known to have effects on human life. And obviously, 5G is a lot stronger than 1G, 2G, 3G, and 4G, and light, for that fact. Is the government willing to have independent study or review done outside of the recommendations from overseas professionals, just to make sure that the people of the Cayman Islands are safe, is ultimately what I'm asking, Madam Speaker.
Honourable Premier.
Madam Speaker, there is no body or expert in the Cayman Islands that has the degree of knowledge and information and ability as do the number of organizations that I referred to just now. The Institute of Electrical and Electronics Engineers, the International Committee on Electromagnetic Safety, the International Telecommunications Union, and the World Health Organization. We can't better that, Madam Speaker.
Member from Savannah.
Thank you, Madam Speaker. I just would like to support what the member from Central have listened to articles on BBC. I've seen where other situations within the United States. And let me tell you, there is grave concern, whether it be by social media or whatever, of these towers that need, and what I was looking at and what they were sharing was how close they need to be for these services to be effective. All I would ask the Minister and his support staff to make sure to know what we're getting into, because it's going to be like the cell phones. When you hear they say they're not giving out radiation thing, when the onslaught of brain tumors start to hit, you'll wonder what happened.
Member for Georgetown Central. Sorry. Honourable Premier.
Madam Speaker, the world is full of conspiracy theories and speculation. We have to operate on the basis of evidence. Otherwise, I think we would be so paralyzed by fear, we wouldn't do anything in this world. No, the office cannot legally or legitimately deny a license to an applicant without good cause. So unless there is some new scientific evidence that comes to light or some change to the international standards, we would expect that the license process would proceed in the usual way. However, the World Health Organization is conducting a study on the effects of exposure to radio frequencies, including those used by 5G, and this report is set to be published in 2022. Section 62W of the URCL puts an obligation on OFREG to take such action as the office considers necessary to protect the health and safety of the public in relation to utility services. Accordingly, if this report or any other credible report provides evidence that 5G or any other ICT technology poses a danger to the public, the office will, of course, take the necessary action to protect consumers. But I repeat, as of now, there is no credible evidence available in the world that 5G poses any danger, or indeed any greater danger to humans than any other form of electronic communication.
Yeah, thank you, Madam Speaker. I'm going to try to ask all three of them one time then. Madam Speaker, I want to say firstly thanks to the Minister, and by all means, I don't want him to think that I am trying to deter the benefits of 5G in this country, but merely to make sure that the good people of the Cayman Islands are safe from any potential harm. If there is none, then it's good for us to be leaders in the technology, because we want to be first, particularly with our financial services and all the services that we offer the world. But that being said, Madam Speaker, I'm asking that the Minister ask OFREG to provide the honourable members of this House, if not the honourable members, at least myself, what sources do they use to determine that 5G is safe for the people of the country? And I understood that the Minister said that there's a new applicant. Is that separate from the current two providers that we have now? Are we going to have a third competitor? Or is that application for 5G from one of those current ones that we have? The Minister also referred to a report that is going to be released in 2022 that will have some sort of conclusions as to whether or not it's safe or unsafe. Can the Minister say whether we're going to grant approval to 5G before that report is completed? Because if you grant that approval, it's installed, and then the report comes back and says that there's things unsafe, I don't think that would make logical sense. Thank you, Madam Speaker.
The honourable member is insisting that I read for the third time what I've already said in response to the measures that OFREG is taking, that there is absolutely no evidence, no credible evidence of any issues with 5G, that I listed the number of international entities, including the World Health Organization, who have said so, and I mentioned the fact that there is a major study that is on the way.
I haven't at all discussed effects on bees, birds, and plants, and there are a number of studies showing damage, and this might even be a worse situation as to nature than we have for human beings in the future. And personally, I'm not quite convinced that the brain tumor issue is the biggest problem. I think there are much more other health effects which are unknown so far with 5G, and also effects on nature which are unknown. I would end with this picture showing, I was interviewed by a Swedish journalist a couple of weeks ago, and she said all the time, like a mantra, that the majority of researchers say that this is safe. There is no risk whatsoever with anything with radio frequency. She had interviewed before me a Swedish prominent person, Maria Feisting, but what you can think of is that this is not the majority. They are quite few. The majority have, for example, signed the EMF Science Appeal, which is almost 250 scientists that have signed it, and all with their own research in this area, like Martin Paul and others. These persons are sitting in different organizations, as you can see here, within WHO group, expert group, within ICNIRP, without United States AGNIR, without the Swedish Radiation Protection Agency, and with SKINIR. And the problem is here that you will get repetition of what is said, because, for example, Maria Feistings, she says that she's not here to defend, but she has heard this from me before, so she knows it. She can say, but look here, ICNIRP came to the same conclusion, and look here in the United Kingdom, AGNIR, and the Swedish Radiation Protection Agency, they came to the same conclusion. The problem is that it's the same persons. If you in ICNIRP come to one conclusion, you are not expected to go to another organization and come to a different conclusion. So this is a very dangerous situation, because like SSM in Sweden, they are not allowing any critical person. All the persons who are sitting there are those yes or no sayers. I mean, they say, no, there is not any risk. And they make their assessment yearly, updating what evidence has come. They do not make an overview of several years, for example, what is the total pattern. For example, when the NTP study came out with the American animal study, Maria Feisting was very quick to go out to media and say, well, yes, look here, the researchers who were doing the microscopic studies of exposed and unexposed animals, they knew what animals were exposed and who was not exposed, so they were biased. And NTP was contacted and said this was not the case. We have good qualification of what we are doing, and this is published. But I mean, if you can't do anything else, you create doubt. I mean, like a book which is written, doubt is their product, which comes from industry. So I would say that the situation just now is more alike than this, and we need people to waken up. The scientific data are there. It's clearly this type of radiation is dangerous to human health and maybe to nature. And I would say that it's time to act and not to let 5G to be implemented all over the world until research has been done. I mean, it's fine if there is no risk, but that needs to be shown.